Hello class and welcome to another exciting facilitation for this semester. I am Dr. Annie George, Department of Public Health, Faculty of Health Sciences, and will be your guide. Hope we all enjoy it. Thank you.
Welcome to another facilitation session on essential drugs, PHS 426. Last week on topic 4, we looked at essential drug lists in the primary health care. We discussed those lists at the primary level, at the secondary and tertiary levels of healthcare. We looked at the lists and then the drug components and what they are used for. This week we'll be looking at topic 5, the concept of drug revolving fund. So at the end of this lesson, we should know how drug financing system works, understand the principles of drug economic strategy and the drug supply system. So let us start by the concept of drug revolving fund, DRF. Drug revolving funds, like we've always known from the previous lecture, is basically the initial capital investment on drug supplies, and such supplies are now replenished by the monies collected from the sales of that drug. So when you sell such drug, you use the proceeds of your sale to procure or to purchase new ones for use, and by that essence, you recycle the funds. So that is called the drug revolving funds. So this brings us to financing the drug system. There are mechanisms, what we call the mechanisms for financing drug. When you look at such mechanism, you consider the cost of such medication, access to such mechanism, medication, and then household spending. Drug financing is centered on all this. How do people access drugs? Most of spendings of the household is on drugs, and then you look at the cost of such medication as well. So the mechanisms of financing drug system is centered on the free of charge mechanism and the cost sharing mechanism. How do people get medications and how are medications funded in various systems in every country? Some get these medications free of charge, and some get it by through cost sharing mechanisms. We'll look at each of these in turn. Now, how do people get medications free of charge? Now, some medications are given free of charge, like to refugee camps, internally displaced persons, and people who are absolutely poor. Poor settings, they get medications free of charge from government donor agencies because they cannot afford ordinarily to get those medications. However, we categorize it into two areas. Despite the fact that these settings get these medications free, the people who supply these medications could be through public financing or through NGOs or donor or bilateral organizations. Now, through public financing is usually from general revenue through taxations, either through loans or donations. So government actually finances these medications and supplies them free of charge to this vulnerable population. However, financing of healthcare in terms of these medication financing varies from different countries, and different state governments or sub-national governments of each country based on needs and based on affordability. Now, we have the non-governmental organizations, the NGOs. We have donors and bilateral organizations like DFID, Pathfinder, Bill and Melinda Gates, USAID, and all that. So these are donor agencies and bilateral organizations that give aids or humanitarian assistance to low and medium income countries, or in some countries where there is a humanitarian or disaster conditions or humanitarian crisis. They offer such help in form of donations of medications and all that to such countries. So that is a free of charge mechanism. Now, the cost sharing mechanism is centered on the fact that there is scarce resources of government, revenue is dwindling. So to improve sustainable availability of medications, access and efficiency of the health systems, cost sharing mechanism is deployed so that the government does not take all the responsibility of funding medication procurement. So in this way, what we call user fee is deployed to reduce such burden on government. And the drug revolving fund is a very, very good example of a cost sharing mechanism, because medications are sold and recycled for procurement of new ones. Some organizations might introduce what we call the flat rate fees, where drugs are charged at a particular flat rate, no matter the medication category. All of them are charged at flat rate. And then some use insurance, health insurance mechanism, to do what we call prepayment of medications before they access health care. They have insurance already and medications are already paid upfront. So, looking at drug financing in developing countries, financing medications in developing countries usually restrained by poor and dwindling government revenues, like in Nigeria. Revenues from government is not adequate for budgeting in the health sector for procurement of adequate medications necessary for the use of the population. In some instances, we have poverty, we have lack of education, and burden of diseases hampering people's capacity to procure medications for themselves. So when people are poor and they are not educated to know that medications are needed, and then in some cases burden of diseases might be debilitating for most families to afford medications. Then other competing critical sectors of the economy like education, housing and all that, and security situation like in Nigeria might hamper the availability of resources needed for procurement of medications. So budget cuts here and there, might affect, the health systems. So obviously, that will, make the health systems weak and other sectors of the economy as well. So what are the principles of drug economic strategy? Now we've looked at, things that affect drug procurement in developing countries. What are the principles of drug economic strategy? What are those economic strategies that are deployed in enhancing drug availability and access in most countries? So the objective of this strategy, economic strategy, is to improve and facilitate access of essential drugs. And the responsibility and will of the state to participate in paying the national drug bill is key. Money saved through selection of drugs and rational use of such drugs serve as a source of additional income for purchase of another medication. So when you select drugs appropriately and you use your medications in a rational way, you're able to save to purchase medication. So that saves money. So it's an economic strategy that saves money. Like the former one, the responsibility and the will of the state to participate in paying national drug bill, which most countries don't even meet up with. Countries should prioritize their health budgets and drug budgets, so that, health as one of those fundamental basics of life, and there is what we call the right to life and right to live in a healthy condition. Governments across board should prioritize their budget and spending in the public health by procuring medications and providing health facilities to people who need them. So, drug revolving fund, the drug supply system. Now, let's look at the drug revolving fund and the supply system, that makes drug revolving funds work. First, you have to select the medications, and when you select the medications that are essential drugs for any community or population, you draft such lists, of those your drugs that should be in the revolving fund. Then you procure. In procurement, you have to do what we call the need assessment of the procurement processes that are needed. Then what are the sources of your medications? You should look for vendors that are non-profit vendors so that the costs and affordability for such drugs is enhanced. And then you look at the drug revolving fund procurement strategies. What are the processes involved based on the peculiarities of each country? And then you look at the pricing policy. Pricing policy is very important because the drug revolving fund is a non-profit system. Basically, you sell at the cost prices of those medications, and then you get it back and plow it into procuring another drug. So when you're looking at the pricing policy for people who are buying those drugs at the health centers and the health clinics, you are not maximizing profit. It's basically at no benefit. You're looking at service delivery. That is the key. Service delivery and not profit. So what are the advantages of stock inventory? So in drug revolving fund, we look at stock control and stock inventory. Control of your inventory and control of your stock and control and inventory stock is very, very key in the revolving drug supply system. So what are the advantages of the stock inventory? The advantages are as follows. It helps to enforce procedures and regulations designed to prevent loss. When you regulate and control your stock inventory, it helps to make sure that the procedures and regulations are designed to prevent loss of your inventory or loss of your stock. So such inventory ensures that security measures and records of received stock and dispensing of drugs are adequate. So when you receive your stock and then dispense of those drugs, the measures you take are adequate. So those security measures are adequate and your records are adequate. So such inventory also guarantees that the control of cash collection and reconciliation of drugs that you sell and the cash collected, are balanced. It also identifies and removes surpluses, expired and obsolete stock from your inventory. And then stock taking at health facilities prevents loss through leakage. So these are inventory system. The stock inventory helps you to guarantee all this. So these are the advantages of stock inventory. So in summary, we've learned drug financing system, understood the principles of drug economic strategy, and finally understood the drug supply system. So in our next lecture, we'll be looking at classification of other public health aspects of drugs. Thank you for listening.